Okay, so let's take a look at criteria A of opioid use disorder. So all of this is consistent with our cross-cutting definition of use disorder, where we'll see over a 12-month period, larger amounts, longer period, uh, persistent and often an increasing persistence. Uh, of desire unsuccessful efforts cut down or control, and great deal of activity is spent necessary to obtain and recover from its effects. The one thing that I'll share with you observationally about opioids, and this is unique to street versions, particularly heroin of opioids. Not necessarily the same case with prescription opioids, but I've heard both from people in media who have uh, talked about their own opioid use disorders, and I've heard this more directly in my own clinical work, is that one of the things that can be unique about street versions of opioids like heroin is this sense of addiction from the first use, meaning that people will say, I don't mean 100% of the time, just sharing something I've heard multiple occasions, is that after one use, and almost instantaneously, they feel hooked. That the high sensation is so powerful, so good, that they feel this sense of hooked or addicted, using their words, immediately from the first use. And that's not something I've necessarily heard in other substances, including other forms of opioids. And of course, fulfill, decreasing ability to perform um, your role obligations. I think the other thing that might be somewhat unique about opioid use disorder is that there are two distinct paths as I see it. Now, this is just me, not from the book, um, meaning paths to developing a use disorder. Some people, often because of social circumstances, will uh, experiment with street heroin type of opioids or opioids like heroin for recreational use or for self medication, or of course both. And that's their path, if you will, that's sort of meaning socially that takes them from first use to a use disorder. And then there are other people who are develop a use disorder through a prescription. Now, that can be a prescription that they begin to overuse. And that can be, and this is, there's different opinions about this for sure, but I believe that I have seen firsthand, and certainly heard other people, again, in the media, through news media stories, that kind of thing, talk about that the prescription they were given, they took exactly as prescribed and developed a use disorder. And those use disorders oftentimes lead from prescription based use to street use. So those are a couple of things that I think are somewhat unique about opioid use disorder. Okay, so moving on to the rest of criteria A, um, continued problems despite continued use, and sometimes often continued increasing use, uh, despite persistent, recurrent social related problems and consequences. Um, Things are given up and replaced with the seeking and using. Um, and recovering. And, with an opioid use, particularly in the street versions, but not exclusively to, that cycle of seeking, use, recovery, uh, relatively immediate seeking because of the level of the immediacy of cravings, um, can be much more rapid, develop more rapidly, and be more rapid itself, meaning seeking, use, recovery more seeking can happen in a way that with a pace that may be accelerated, or at least accelerated more quickly from than versus other substance classes, and other substances. And then the last piece on 8 and 9 here: use in situations hazardous and physical and psychological consequences. So the social consequences and the psychological consequences can pile up pretty quickly because opioids can be or are so sedating, and it's it's pretty hard to hide intoxication, or have intoxication without social consequences. It's very hard to perform your roles in intoxication. Certainly, some people develop use disorder in which they're using just enough to keep the withdrawals and the cravings at bay, um, and maybe physical symptoms at bay of withdrawal and cravings, um, and are somewhat able to perform their roles. But again, usually that doesn't, that fades. The ability to do so fades over time. Um, and then, so back to the 8 and 9 part. Um, One of the things that's, is in probably anybody who's worked in an emergency room, um, as a nurse, a doctor, or a social worker, can tell you that one of the things that can be one of the most challenging things that you experience in the emergency room are the level of physical injury to people who are intravenous substance users, which of course doesn't have to be opioids exclusively, but certainly people who are using opioids intravenously, and sort of the deterioration of their lives that goes along with it, will often develop um, significant medical problems in the form of, from infected injection sites, and maybe multiple infection injection sites, and then that can turn into serious medical problems that can involve uh, emergency amputations, and you know necrotic tissue, and just really significant physical damage that is even hard for the provider to experience, let alone the individual themselves. That's what I try to do here, is just highlight some of the things that are at least a little bit unique to opioids, or at least in some circumstances. So that's the summary of criteria A.